Hey everybody, welcome back to the Outcomes Rocket. We are here at AHIP 2024 in Las Vegas at the Amazing Win. And today I am with Tanya Little, Chief Commercial Officer at Vitality Group. It's such a pleasure to have you here on the podcast with us.
Thank you. Happy to be here.
Yeah. So about 2 years ago, we did an interview with Steve Mitchley from Vitality Group, and a lot has changed. So I'm really excited to have Tanya back on the podcast with us today. Tanya, to kick things off, tell us a little bit about you and what inspires your work in the healthcare and payer space.
Well, at my core, I'm a behavioral economist, behavioral scientist, trained at London School of Economics. And I raise this because everything about Vitality is driven on the premise that people are rational. Humans don't make the best decisions for themselves, whether in their healthcare or their finances. But in context of healthcare, what this means is we don't move enough, we don't eat well, we don't take our meds, we don't follow our care plans, we don't do prevention, even though we know we should. So Vitality is all about helping payers reach members and help them do the things that are in their best interest. In other words, it's about bridging the gap between current me and future me. The reason this matters is because these modifiable behaviors are what drive a huge proportion of the premium dollar and of healthcare cost. So if we can help payers engage their members and help them make the right decisions and then take action, that is really, really meaningful in context of shifting the healthcare curve and bending that cost curve.
That's great, Tanya. And, you know, we were chatting before we started recording, and yesterday's session, this similar sentiment was echoed by Amazon Pharmacy's chief medical officer. He says, there's a lot that we can do today. There's things that we have available today to change. And that's what you're speaking to.
Bingo. It's exactly that. And the question is how to do those things. Ultimately, you need a relationship with the member. You need a relationship with the member so that inside and outside of care-seeking moments, you can help them make good decisions. And so really the magic is in, well, how do you do that?
Yeah.
And that is what Vitality is all about. And I think that was referenced again yesterday.
Totally. So let's unpack that. What is Vitality Group focused on, and why do you guys exist? How do you offer value to payers and providers and the member?
Yes, cool. We were birthed by a health plan, in fact.
Oh, okay.
In 1992 in South Africa. So
in South Africa.
In South Africa.
Very cool.
So two actuaries started up a health plan. And they realized in the context of that health plan, they were operating community-rated insurance, undersupply of doctors, high and complex disease burden. Does this sound familiar?
Yeah.
And in that context, they realized they couldn't shift healthcare supply, but they thought they could shift healthcare demand. And by that, they thought that they could shift people away from sick care and into preventive care, into doing the right things.
Yeah.
So they launched Vitality. And what Vitality is it's a blend of behavioral science. That's why I referenced this at the outset.
Totally.
Actuarial science, tech, and incentives. And we use this fusion to help payers, help their members do the right things. In South Africa and the UK, we are the risk bearer. We are the insurer. And then in 38 other markets across the globe, we are partnered with the insurer.
Fantastic. Yeah.
So we're reaching 35 million members. And really what we're helping payers do is engage their members. And I think what I'm hearing come up a lot at the AHIP conference is this concept of engagement. Because if you can't engage a member, how do you get them to do anything important? You can't get them to close the gaps in care, or you can't get them to do the prevention. You've got to be able to engage them, and it's hard.
Yeah, totally. And, you know, I love the founding story. You know, you guys started off as a plan. So talk about walking a mile in the shoes. You guys are doing it. You understand the pain points personally. And I think that's great. I think of it kind of like a vertically integrated provider that understands that. So you have a unique.
You draw the parallel. Yes.
Yeah, it's a unique perspective. So I love the value and the perspective that you guys bring to the picture.
Right.
Here at AHIP, we've had a lot of different conversations, from GLP-1s to, chronic care management.
Yes.
What's risen to the top for you as insightful?
So one of the things I found so interesting is a juxtaposition of the inertia of the healthcare system, in the sense of, not enough collaboration, stubborn costs, rising costs. And yet, at the same time, everything is changing so fast. So the advent of GLP-1s, AI, and what that means. And so meshing like this juxtaposition, I found that really interesting. I think a core underlying theme, and at the risk of, when you have a hammer, everything's a nail, but really engagement is a big deal.
Yeah.
And there's been a lot of conversation around, like, how are you reaching your members and what are you doing? SDOH, GLP-1s, specialty meds, a lot of conversations around data interoperability as well, and how do you forge partnerships across the healthcare ecosystem in a meaningful way to achieve VBC.
Yeah, and that's a really great point. All the change that's happening around, but the inertia that kind of is keeping things the way they are. At what point do you think we're going to see a shift?
I think it takes a village.
Or are you seeing a shift anywhere?
Yeah, I think that these disruptions force shifts. So
Yeah.
I think, there's something around, you see a GLP-1 and now this creates the need to respond. It's not like, I can think about this for too long. As a payer, I need to really establish what are my principles here? What am I going to cover? And what am I going to ask the member to do in that context?
Sure.
So there is a forcing mechanism there, but truly I say it takes a village because it's not around like one actor that can flip a switch and it's
Totally.
done.
Yeah.
There is something around how do you collaborate and how do you create some momentum, which I think that's what AHIP's all about.
Yeah, no, the momentum is being creative. You guys are creating the momentum. So
Yes,
I want to
we
give
like to
you
think so.
and Vitality Group huge kudos for the work that you're doing to shift that, to bring innovation into the system. What call to action would you leave to all of our viewers and listeners as they wrap up today's interview watching us?
So I would say to our listeners, spread the word, please, because truly
Spread the word, guys.
Spread the word, truly in the sense of think about the power of engagement. And I'm saying think about the power of engagement in driving quality. So, care gap closure, prevention. Yeah. Think about it in terms of the member experience, caps and what that could mean. Think about it in terms of building a relationship with a member. Like we partnered with John Hancock. They now have a relationship with their members where their members are engaging with them up to 20 times a month and enjoying it. Wow. What could that mean for shifting healthcare? What could it mean if you could do the right things and feel great about doing it? So it's to spread the word, and it's also go to vitalitygroup.com because you'll learn more about us. Check us out on LinkedIn as well. And then finally, on a personal note, as a viewer, think about your own behavioral biases. Think about what is getting in the way of you getting involved in your health as meaningfully as you could. And anyone who wants to geek out on behavioral science, I'm your gal, so reach out.
Love it. Love it. Well, folks, there you have it. Tanya's with us. In the show notes, you're going to find a quick links to all the ways to get in touch with her, Vitality Group, as well as a short summary of our discussion. And behavioral economics, she's your girl. So if you guys have a podcast out there that you want to cover maybe this a little bit deeper, definitely one that I would check out. So make sure you do that. Tanya, thanks for being with us.
Thank you so much for having me. Appreciate it.
Take care.